Hi, my name is Alicia Silva. I am going to go over case 4 and 2 of our Unit 2 case connections. Let's get started. So case 4 is a 4-month-old female presenting for hypoglycemia, tremors, hepatomegaly, and an elevated lactate. So what we know is the baby cannot maintain her glucose when she's not actively eating. She has an enlarged liver, and when administered epinephrine, we note an increase in her blood lactate. As we learned in week 4, epinephrine is a hormone that signals for an increased use of blood glucose while exercising or in an emergency situation and activates liver glycogenolysis. So glucose is oxidized to pyruvate. However, there's a negative feedback in the TCA cycle causing an accumulation of pyruvate to then produce lactate. All these symptoms are leading us to view how the liver is processing the glucose, and that would eliminate galactosemia because she's being fed breast milk, and in breast milk we see lactose and galactose. We see an increase in her blood glucose, but the problem is that she's not maintaining her glucose, so leading us to look at the clinical signs that are indicative of galactosemia, which are tremors, ascites, vomiting, loss of appetite, diarrhea, and lethargy. And we don't see that with this individual. So now we want to look at hereditary fructose intolerance. The condition is when the body cannot break down properly sucrose or fructose. That is usually found in fruits and some formulas because the body is lacking an enzyme called aldolase B. Again, that helps break down fructose. So those clinical signs are nausea, vomiting, abdominal pain, seizures, and the failure to thrive. So again, that can be ruled out since the baby's not exhibiting any of those signs. So now we look at glucose 6-phosphate, and that plays a large role in the formation and the degradation of glycogen. So as we learn, liver glycogen is used for blood glucose since glucose 1-phosphate is converted to glucose 6-phosphate and through the degradation and the help of glucose 6-phosphatase. So now that is just kind of touching the tip of the iceberg of what we're seeing during the formation and the degradation of glycogen. There's so much more information that I could go over, but to put it in this time frame, we're just going to go with that. So with this information, we start looking at glycogen storage disease, or GSD, to be the overlying diagnosis of what's going on with this baby. So in GSD, there is a defect in the enzyme required for glycogen degradation. So that causes the abnormal structures of glycogen or the accumulation of glycogen in different tissues that can cause an array of symptoms, like we are seeing hypoglycemia and muscle weakness, to name a few from my research on this. And looking into the clinical signs of GSD, we see hepatomegaly, lethargy, tremors, and hypoglycemia because of the excessive glycogen being stored in the liver instead of being released into the bloodstream. So that one is more of a differential, and it cannot be glucose 6-phosphate dehydrogenase deficiency because the baby's not anemic. Anemia is a big differential or clinical sign for the deficiency, and we don't see that. And also other signs are jaundice, shortness of breath, and having dark urine. Based off these clinical signs, we can say that that is not what we're exhibiting, and so I would say the baby has GSD. So for case 2, we have a 16-year-old female that is diagnosed with muscle glycogen phosphorylation. She has a few questions that we can hopefully answer and make her understand a little bit better about her disease process that she has now. So the first question is that she does not understand the issue at hand. Could we explain a little bit more of the muscle glycogen and how that's used normally during exercise? So to be as simple as I can, the muscles in our body need energy to move. Think of a car. It needs gas to make it move forward, and when it's stationary, it is stored in the gas tank until we use it. Same goes for our muscles. We consume food to get the glucose or sugars to fuel our body. The glucose is then stored in our muscles or liver as muscle glycogen or liver glycogen, i.e. glycogen. And that function is to serve as a fuel reservoir or energy reserve for when we exercise or need to contract our muscles. Energy is needed in our body, and when we do need it, we need to go through glycogenolysis, or the breakdown of glycogen that we have stored to use in our body. So in figure 1, we can see how we explain it a little bit. Glycogen gets translated over to glucose 6-phosphate, and that becomes energy. And that is because of the help of an enzyme called glycogen phosphorylase, which starts the reaction to break down the glycogen to make glucose 6-phosphate, then goes through another process called glycolysis to make energy. So question 2, she asks, is she really likes to take long walks, and would she be able to take those with her friends? And the answer is yes. She would be able to take long walks with her friends. Just be mindful that since her body is deficient in the enzyme muscle glycogen phosphorylase, she would not be able to break down the stored glycogen as easily. So as mentioned before, the enzyme glycogen phosphorylase, aids in the conversion of glucose to glucose 6-phosphate to ATP or energy that the muscles utilized for the contractions and movement. So she will notice that she will get a little tired more quickly than her friends, and when she starts feeling tired, she should take a break, maybe eat a little snack, and then continue on and have plenty of water with her so that she can continue to produce the energy that she needs to continue going on these long walks. But going on these long walks is totally fine. The third question that she has, as a result of this deficiency, she will need to get up at night to eat to maintain her blood glucose levels. The short answer is no. She does not need to. She will not need to wake up in the middle of the night to have a snack to maintain her blood glucose levels. When you're sleeping, the liver is performing glyconeogenesis and glycolysis to maintain the blood glucose levels. Insulin and glucagon are hormones that are used to regulate blood glucose in the fed and the fasted state. So when the body is sleeping in the fasted state, glucagon levels are more elevated, which stimulates the release of the stored glycogen from the liver, and with that also it stimulates the conversion of lactate, amino acids, and glycerols to glucose. So majority of the blood glucose production is in the liver, and so while muscle glycogen is produced during exercise and requires energy that we get in the fed state, you don't have to worry about eating in the middle of the night to maintain those levels, because it's mainly being done in your liver, and you have everything in your body that is necessary to continue producing the main levels of blood glucose that we need. But if you're ever concerned, you can always speak to your primary medical doctor and get more of a reference for that. Here I have a little bit of a diagram showing how the liver uses the glycogen, and that gets converted into glucose, and when glycerol, amino acids, and lactate are there, where the glucose goes, and how it switches over to other peripheral tissues, red blood cells, in the brain. And for her final question, we have, does she need to be worried about producing excessive lactate during intensive anaerobic exercise? While we exercise, we do produce lactate as a byproduct of the muscles and the red blood cells, which are done through glycolysis. Normally, we are able to clear the lactate with lactate dehydrogenase, in the conversion of pyruvate, then have those shuttled through the TCA cycle and then made back into glucose. So it's a cycle to go back to make glucose and energy. And with that glucose, we go back to using glycogen and the glucose 6-phosphate turned back into energy. So if the body gets a buildup of lactate and is not effectively able to convert it, then we have a lactic acidosis, as we had learned previously, which can cause muscle soreness, fatigue, nausea, weakness, and vomiting. So in her case, we don't need to worry about producing an excessive amount of lactate in her body. She may feel a little bit more tired with the intensive exercise, but we have a way in our body to convert that lactate back into glucose or using it as energy, so she shouldn't be worried. But if she is ever concerned, or if you're ever concerned because you have persistent fatigue or muscle soreness or weakness, please contact your primary care physician.